Hi, welcome to our channel of ignou audiobooks, Indira Gandhi National Open University, School of Social Sciences, SOSS, Master's Degree Programs, MA in Psychology, MAP, Second Year, MPCE 0 to 3 Interventions in Counseling, Block-2 Cognitive Behavioral Counseling, Unit-3 Cognitive Behavior Modification, 3.0 Introduction. Cognitive behavior modification is a most commonly used intervention in counseling. It focuses on identifying dysfunctional self-talk in order to change unwanted behaviors. In other words, behaviors are viewed as outcomes of our own self-verbalizations. Hence, by changing our self-talk, we can change our behavior. Cognitive behavior modification, CBM, was developed by merging behavior therapy with cognitive therapy. It is an intervention that combines cognitive and behavioral learning principles to shape and encourage desired behaviors. Although behavior therapy and cognitive therapy are drawn from different theories, each shares an emphasis on alleviation of symptoms and a focus on the present in developing a course of treatment. In cognitive behavior modification, the client is trained to recognize destructive or harmful thought patterns or behaviors, then replace them with helpful or constructive thoughts and behaviors. To be more specific, cognitive behavior modification refers to theoretical and applied orientations that share three underlying assumptions. A. An individual's behavior is mediated by cognitive events. B. A change in mediating events results in a change in behavior. And C. An individual is an active participant in his learning. In short, the cognitive behavioral approach assumes that individuals have both the capacity and preference for monitoring and managing their own behavior. Heflin-Simpson, 1998. In this unit, the different techniques of cognitive behavior modification will be described. 3.1 Objectives. After going through this unit, you will be able to define cognitive behavior modification, describe the meaning of different techniques of behavior modification, explain the different techniques of cognitive behavior modification. Analyze the application of behavior modification techniques in counseling situations. 3.2 Techniques of cognitive behavior modification. In the earlier unit, Unit 1, cognitive behavior modification has been described in detail. Here we will focus on the 4 techniques used by counselors under cognitive behavior intervention. These are techniques of stress inoculation, self-instructional, self-management, and problem-solving. 3.2.1 Self-instructional technique. Self-instructional training was developed by Donald Machenbaum, 1977, as part of cognitive behavior therapy. We usually engage in self-talk, and the nature of our self-talk affects our behavior. Faulty and irrational verbalizations result in anxiety and other emotional and behavioral problems. Hence, in self-instructional training, the clients are taught to keep track of self-statements that are destructive or negative, and are then given training to substitute them with more adaptive ones through homework assignments and practice. Thus, healthy self-talk replaces the negative self-talk or internal statements. Identifying and modifying the negative, destructive, unhealthy internal statements to positive statements reduces the stress and anxiety. First, the client is made aware of the negative self-talks going on within him. Then, the client is helped to realize how his negative verbalizations lead to the anxiety or fear or other emotions and behavior of him. Next, the client identifies the positive self-talk he needs to do in place of the negative ones. He is then given training to make the positive self-talk a part of him through practice. The self-instructional training can be used successfully to deal with anxiety, fear, addiction, compulsive behaviors, unhealthy eating habits, etc. For example, the child who is obese has unhealthy eating habits. He eats junk food and goes on eating very frequently. He is not able to stop eating and gobbles up more than he should be eating. Self-instructional training can help him control his eating habits. The child needs first to identify the kind of internal verbalizations that goes on while succumbing to the temptation of eating. Then he has to practice positive self-talk, which will be his instruction to the self whenever he engages in unhealthy eating habit. 3.2.2 Stress Inoculation Technique, SIT, Stress Inoculation Training given by Machenbaum, 1985, is a complete cognitive, behavioral intervention package that makes use of cognitive restructuring, self-instruction, self-monitoring, problem-solving, relaxation training, etc. Stress inoculation training prepares the individual in advance to handle stressful events successfully. The use of the term inoculation is based on the idea that as vaccination inoculates people against diseases, similarly stress inoculation training helps inoculate the person against the stressors in life. In SIT, patients are educated about stressful situations and the general nature of stress, the negative outcomes they may be vulnerable to experiencing when confronted with stress, and steps they can take to avoid those negative outcomes. Thus, stress inoculation is designed to bolster individuals' preparedness and develop a sense of mastery. The treatment goals of SIT are to bolster the client's coping repertoire, intra and interpersonal skills, as well as their confidence in being able to apply their coping skills in a flexible fashion that meets their appraised demands of the stressful situations. In SIT, the clients become more aware of what things are reminders, also referred to as cues, for fear and anxiety. They learn how to detect and identify cues as soon as they appear so that they can put the newly learned coping skills into immediate action. In doing so, the patient can tackle the anxiety and stress early on, before it gets out of control. SIT consists of 3 interlocking and overlapping phases. Phase 1, Conceptual Educational Phase. In the initial conceptualization phase, the client is educated about the nature of stresses and how certain ways of thinking leads to stress and mental disturbances. They are helped to differentiate between aspects of their stressors and their stress-induced reactions that are changeable and aspects that cannot change, so that coping efforts can be adjusted accordingly. Acceptance-based coping is appropriate for aspects of situations that cannot be altered, while more active interventions are appropriate for more changeable stressors. Phase 2, Skills Acquisition and Skills Consolidation Phase. In the next phase of skill acquisition, the client is given training on a variety of skills, such as emotional self-regulation, relaxation, problem-solving, cognitive appraisal, cognitive restructuring, communication and socialization skills. However, the particular choice of skills taught should be on the basis of the client's unique needs, strengths, and vulnerabilities. The skills are then rehearsed so that they become easy to act out. Phase 3, Application and Follow-through Phase. In this last phase of application, the client applies the skills learned in the real-life situation. The client is also provided opportunities to practice coping skills in simulated situations using the methods of visualization, modeling, and role-playing. After counseling is over, follow-up session is organized to find out the effectiveness of the training the client received. Stress inoculation training aims at building psychological immunities in the individual to deal with stress. It has been helpful in reducing interpersonal and general anxiety. For example, these techniques may be used when a person has an upcoming job interview, speech, or test. Stress inoculation has also been used to treat phobias, fear of heights, and chronic anger problems. It is used as both a treatment as well as a preventive measure. Stress inoculation training is not merely a collection of different coping techniques. It is more than that. It is highly client-sensitive and involves collaborative mechanism keeping in mind the client's goals and future plans. All these contribute to the comprehensive and robustness of stress inoculation therapy. 3.2.3 Self-management technique. Self-management strategies make use of cognitive and behavioral skills by the individuals to maintain self-motivation and achieve personal goals. Most people who decide to use self-control or self-management strategies are dissatisfied with a certain aspect of their lives. For example, they may feel they smoke too much, exercise too little, or have difficulty controlling anger. Thus, the goal of self-management strategies is to reduce behavioral deficiencies or behavioral excesses. Behavioral deficiencies occur when an individual does not engage in a positive, desirable behavior frequently enough. For example, a student who rarely studies may not graduate. Behavioral excesses occur when an individual engages in negative, undesirable behavior too often. This results in a negative future consequence. For example, a person who smokes may develop lung cancer. The client is taught to identify, monitor, and bring changes in his behavior deficit or behavioral excess so that it leads to desired behavioral changes. There are a variety of self-management strategies that make use of stimulus control, reinforces, and punishers to modify the undesirable behavior. In fact, these strategies can be grouped under three broad categories such as I. Environmental strategies, 2. Behavioral strategies, 3. Cognitive strategies. I. Environmental strategies. Environmental strategies involve changing times, places, or situations where one experiences problematic behavior. Examples include changing the group of people with whom one socializes, avoiding situations or settings where an undesirable behavior is more likely to occur, changing the time of day for participating in a desirable behavior to a time when one will be more productive or successful. 2. Behavioral strategies. Behavioral strategies involve changing the antecedents or consequences of a behavior. Examples include increasing social support by asking others to work towards the same or a similar goal, placing visual cues or reminders about one's goal in one's daily environment, developing reinforces, rewards for engaging in desirable behaviors or punishers for engaging in undesirable behaviors, eliminating naturally occurring reinforces for undesirable behavior, engaging in alternative, positive behaviors when one is inclined to engage in an undesirable behavior, creating ways to make a desirable behavior more enjoyable or convenient, scheduling a specific time to engage in a desirable behavior, writing a behavioral contract to hold oneself accountable for carrying out the self-control program. 3. Cognitive strategies. Cognitive strategies involve changing one's thoughts or beliefs about a particular behavior. Examples include using self-instructions to cue oneself about what to do and how to do it, using self-praise to commend oneself for engaging in a desirable behavior, thinking about the benefits of reaching one's goal, imagining oneself successfully achieving a goal, or using imagery to distract oneself from engaging in an undesirable behavior, substituting positive self-statements for unproductive, negative self-statements. Thus, self-management techniques use self-observation, self-instruction, self-praise, self-reward, and self-punishment to bring about desirable changes in their behavior. Self-management strategies are useful for a wide range of concerns, including medical, such as diabetes, chronic pain, asthma, arthritis, incontinence, or obesity, addictions, such as drug and alcohol abuse, smoking, gambling, or eating disorders, occupational, such as study habits, organizational skills, or job productivity, and psychological, such as stress, anxiety, depression, excessive anger, hyperactivity, or shyness. However, if symptoms are severe, self-management strategies should be used in conjunction with other therapies. 3.2.4 Problem-solving technique. In life, we are faced with so many problems related to our school, college, home, work, and varied life situations. We need to solve them effectively in order to lead an efficient life. Problem solving comes handy here as a tool, a skill, and a process. As a tool, it helps you solve a problem or achieve a goal. As a process, it involves a number of steps, and as a skill, it can be used throughout life to deal with various problems and situations. Problem solving has two distinct phases. I. A problem definition phase and 2a. Problem solution phase. I. Problem definition phase. When defining a problem, be specific, be brief, express your feelings about the problem. When solving problems, brainstorm solutions, evaluate their costs and benefits, decide on the best solution, be willing to compromise. 2. Problem solution phase. Thus, problem solving involves a number of steps, such as problem definition. It involves stating the problem in clear terms. What actually is causing the problem? It helps to think in terms of what actually I want. How is the present situation affecting me? How do I want it to change? All these help in specifying the problem. Problem analysis. After defining the problem, it needs to be analyzed or thought of from different angles' perspectives. This enables in further clarification of the problem. Goal setting. It involves establishing goals, what you want to achieve. Based on your analysis of the problem, what is it that you want to change or achieve? Generation of alternatives. Next step is to generate as many alternatives as possible to achieve the goal. Don't bother about whether they are realistic or will be effective or not. The requirement task is to list down all the possible solutions. Decision making. This step refers to analyzing the solution's alternatives and deciding on a particular solution. Each alternative is examined. Pros and cons are listed out and decision is taken. Implementation and verification. The last step involves implementing the solution you have chosen and evaluating its effectiveness. It is verified whether the strategies, techniques adopted led to the solution of the problem. Problem solving is a cyclical process. If the solution is not found to be effective, again the process starts, and the problem is defined and analyzed again, and goals set and solutions found. The client plays an active role in the problem-solving process. 3.3 Summary. Cognitive behavior modification is a combination of behavior therapy and cognitive therapy. In this intervention technique, you can track from the beginning how your thoughts affect your feelings and then, in turn, your behaviors. If you realize that the originating thought about a situation is irrational, you can realize that the resulting feeling and action are also irrational, and then you can modify your thought. In this unit, you learned 4 techniques of cognitive behavior modification, such as self-instructional, stress inoculation training, self-management, and problem solving. The meaning and procedure for each technique are described. Further, the uses of these techniques are also mentioned. Cognitive behavior modification, CBM, is at the root of treatment for anorexia nervosa and other eating disorders. It is also commonly used in the treatment of various anxiety disorders. Since many eating disorder patients experience co-occurring disorders such as anxiety and depression, it makes cognitive behavior therapy an even more powerful treatment option. Thank you. Subscribe to our channel for more updates, and we will see you with the next chapter.